The treatment plan is one of the most complicated and important pieces of clinical documentation in the system. It feeds into the progress notes and can take time to set up. Please remember to click Save Draft often as you work to avoid losing your efforts. The form can be completed one of two ways. The first is to use the Wiley Practice Planner to walk you through the treatment planning process and then edit to individualize the plan. If you use this option, you will only need to free type the client's abilities and strengths, treatment preferences, statement of needs, update the symptom descriptions if desired, and indicate the treatment level, rationale for the plan, and conditions for its completion. If you choose to fill in the form by hand, you will also complete these sections, but will interact with each of the tables related to symptoms, goals, objectives, diagnosis, and interventions. To add data to the symptom table, click Add Symptom. This will create a new row. You can either double-click on the row to edit it or select it and click Edit Symptom. The symptom name is the behavioral definition for the symptom, say insomnia. The symptom description is the intensity, frequency, duration, and adaptive impairments the symptom cause. For our example, unable to fall asleep for an average of 40 minutes at least 3 times per week causes frequent tardiness at work. On an initial treatment plan, the status will be limited to maintained. In future plans, this field will be set to the latest observed status via a signed progress note. To add data to the problem and goals table, follow the same steps as in symptoms. Here, the goal statement is what you will accomplish during this treatment episode. Most clinicians create somewhere between 1 and 4 goals for a treatment episode. The problem is a field where clinicians can categorize what the goal and related objectives are targeting. Most clinicians use a 1 or 2 word description in our current example, perhaps sleep disturbance. The objective table works similar to the goals table. Here you can create a measurable objective. The patient will learn and implement proper sleep hygiene techniques. In the second column, you will be able to choose from any previously entered problems. So for us, sleep disturbance. The third column allows you to set a target date. Most clinicians stagger these to build a pattern of moving closer to a solution for the problem. The fourth column indicates the modality that will be used to address the problem. If our patient is an adult, for example, it might be individual therapy, whereas if our patient is a child, it would most likely be family therapy, as it would involve the parents. The frequency relates to how often the therapist is going to address this specific objective until its completion. The percentage complete will be set to 0 on an initial plan and will be updated on subsequent plans to reflect the percentage indicated on the latest signed progress note. If a clinician desires, they can also specify the interventions they may use to address the objective. There is an assessment table that allows a clinician to manually enter the scores for any assessments they give regularly. Reports from these assessments may be uploaded on the Document tab. The diagnosis table on the treatment plan can be configured to show the ICD-9, ICD-10, or DSM-5 language. By default, it will show all of these. To search, click Add Diagnosis, highlight the default F99 unspecified mental disorder, and delete it. Enter at least 3 characters of either the diagnostic name or code to search for the diagnosis you believe is most appropriate. If you are still recording a GAF for an insurance requirement, please note you must type GAF, and because the list is long, you may wish to enter the first digit 7, and then select the correct score from the drop-down menu. You may manually record any medications that relate to your therapy. Treatment level is used by larger clinics to indicate the type of therapy: outpatient, inpatient, intensive outpatient, etc. Some smaller clinics use phase of treatment: crisis, acute, stabilization, maintenance, termination. Others will leave it blank if it's not useful for their practice. You can select a standard achievement of these goals as the criteria for discharge or create your own. The rationale addresses the reasons that the plan were edited. Initial for the first plan, status change if new symptoms are reported or symptoms are resolved. Life event if there is an event that affects treatment like marriage or divorce. The most common is the yearly update, which is used for standard updates to the plan. If there is other data you wish to collect, you can add custom fields to the notes. Simply click Add Field and edit the row appropriately. To sign your plan, click on Sign and save and enter your 4-digit PIN. The history of the plan will show at the bottom of the page.